Hi, I'm Dr. Bernstein. This is Dr. Montero, and we're going to have a conversation about a certain type of patient that may come in to see me or her. So this is Jane. She's approximately 55 years old, no major injury, but she comes in and has ankle pain. She's got tingling in the ankle. She's got some numbness in the ankle. Sometimes the symptoms worse with prolonged standing, and the foot's kind of weakish. There's a condition called tarsal tunnel syndrome, which is very similar to carpal tunnel syndrome, where you get entrapment of the nerve around the ankle down into the foot. Locally, I perform a little test called the Tunnel's test. That gives me a good indication that it could be tarsal tunnel, but without Dr. Montero's approval versus is it coming back from the spine, the lower back, or is it a local problem? I'm gonna let Dr. Montero take it from here.
That's right. So even if your symptoms are only numbness, tingling, or weakness in the foot and ankle, it could still be coming from your low back. It could be due to something called lumbar spinal stenosis or any nerve impingement in the low back, where you're only feeling symptoms coming from the nerve with or without back pain itself. The reason for this is that the nerve can get pinched over here in the back, and that nerve travels and gives you those symptoms further down the leg. The difference is that with tarsal tunnel, that the symptoms continue to persist even at rest. Whereas with spinal stenosis, you rest, you sit down, and your symptoms improve, only to return again as you continue to walk. Where Dr. Bernstein does the Tunnels at the ankle, I would do something called a straight leg raise to stretch out the nerve from the low back to see if it's coming from there. At the end of the day, if symptoms are too ambiguous, the most important thing to get done is what's called an EMG. So it's really important for you to seek medical care, because what you may think your symptoms are coming from may not actually be coming from there.
So as you can see, between Dr. Montero and myself, Jane is going to get great treatment. It's a team approach. I won't approach this nerve problem without Dr. Montero and vice versa. And Jane will get the best treatment possible, whether it be a conservative therapy or a surgical therapy. We are a team here at Progressive Spine and Orthopedics.